Stanovich for doing the presentation at St. Greg's. This is something new that we started for this year. We're trying to increase the knowledge of the Catholic Medical Association, the awareness for our colleagues, and I thought that it would be good also to teach the people in the community. You know, a lot of what we believe as Catholics or Christians, as far as what's available in medicine, but what we feel is morally responsible, that doesn't always go along with what the culture is. So that as physicians, we could maybe help educate the community, the lay community, and let them know what the church is teaching on some of the things. Because everything that's available in medicine doesn't mean that we should be doing it, okay? Like most things in life, right? So we've set up quarterly presentations for this year, and Dr. Stanovich was the bravest, and he was the first one, and he did an excellent presentation. I think we just need to kind of get the word out there more. It was fortuitous that it was right at the anniversary of Roe versus Wade. So he did, his talk was on, what was it?
Fetal development.
Fetal development. What was the first one? Intrauterine, or something like that? Fetal development or something? Intrauterine development of the child. And I remember when he first started, he went back to the dawn of time. And I said, wow, how does this got to do with? But he tied it all in there with creation and God's plan. It was excellent, excellent. So he also mentioned a couple things that, which brings our faith into just, we're not looking at just the anatomy of the development of the child. Where does our faith fit in with us? And he talked about, Roe versus Wade. He talked about some spiritual things in the end. It was just beautiful. So I'd like to just thank you. Okay, two other business things I want to get ahead of the game. We are trying something new. I've been asked by the, I forgot the name of the foundation, the diocese, to consider having a medical student scholarship. So right now, because this is really a small organization, we'd like to have it grow. We're going to be looking for donations for a medical student scholarship. So what I did was, I have a table at the back. So if you want to donate, you can get a free CD, and then we have a drawing. There's a nice framed portrait of Mother Teresa, and then you'll get a ticket, and you pick a CD, whatever the talk. These are from previous National Catholic Medical Educational Conferences. They're very excellent. The picture itself, I actually put in 2 CDs there. One is, I think it was Bishop Conley who spoke, and George Weigel was a keynote speaker one year. And so those 2 are going to go with the picture. So whoever wins that gets that extra. But then if you're going to donate, you can just choose a CD for yourself. Okay. I wanted to do another quick little presentation. The National Conference, once a year, educational conference, it's usually different places around the nation so that, if you're in the West Coast, whatever, depending where you are, it's easier for some people to get to. I try to go as often as possible. So we just went, I took my daughter with me this past October, and the topic was healing the wounded culture. So that was a theme. So they had, it was amazing, they had a statue of the scourged Christ, and then they had a statue of the resurrected Christ. And so what they did is they took several different topics, and then they went on what are the wounds, and then what is the healing. So the first one they talked about was the body wounds. These are the things that are going to happen in our culture: abortion, assisted reproduction. There's a physician, Levantino, who's an OBGYN, also a lawyer, who talked about his conversion. He was an abortionist, and it was a job to him. He said he didn't really realize what he was doing. It was just tissue, didn't think about it, and then he had this conversion, and now he tries to go to different places, congressional hearings and things, to try to say that, you know, that is a life, even at the early stages. It was a phenomenal story. There was another physician who talked about the assisted reproduction, and he says how he was into in vitro fertilization, and how he says when he realized what does the faith teach about it and what he's doing, he said, you know, I need to take my knowledge and find ways, you know, as far as hormonal ways to help people with reproduction. He says because IVF, only 10% successfully carry to term. So he says at this rate, you know, people are making money and couples are coming in doing all these different procedures, and most of the time it's not successful, but the doctors are making money. And he said he realized he needed to change that. So those are very touching stories. As far as the healing, body healing, they went through the different crisis pregnancy centers. There was a counselor. She talked about how they're on the front lines, just like Dr. Stan. They're at the front lines at the abortion clinics. They do counseling. They try to show an ultrasound. They do referrals for Rachel's Vineyard, because a lot of those young moms are repeat, you know, having repeat abortions. So, you know, these are the things that we can do to help heal. Dr. Berg is a psychologist who has a website called Silent No More, and that, she says, is for those who have had abortion and need that healing. There's just a lot of depression and other things that go along with those who have suffered that. And then there was Dr. Hildress, who talked about alternatives to the assisted reproductive technologies. And Father Tad, I don't know if anybody's heard Father Tad when he's been here before, but he's a phenomenal mind. But he also talked about what's the church's feelings on assisted reproduction, and, you know, where are the pitfalls that we can fall into. The mind wounds, there was a lot of talk on the problems with pornography. Marriage was interesting because, you know, a lot of what's happening in society is the wounds that the children suffer, you know, with the broken marriages or things that happen to them when they're younger. So Dr. Wilcox talked a little bit about that, and the interesting point I remember was saying how the teen pregnancy, if the dads stayed at home, an intact family, only 5% of those who are pregnant, you know, teen pregnancy, have a dad at home. If the dad leaves when they're less than age 5, 15%. So maybe they've adjusted, maybe moms remarried, whatever. Less than age 5, 15%. But for girls whose father leaves the home at the ages of 6 to 18, 30% of them will have teen pregnancy. So it was pretty interesting that the rates that they had given us. Then as far as the sexual addictions, the same-sex attraction, Dr. Fitzgibbons is a psychiatrist who spoke. He really gave a lot on how, you know, people are always looking at what's the science. Is it just, oh, you have a phobia, you're all homophobic or whatever. He said, what is the science behind it? He says, there's been studies, a lot of studies, where they look at men who have same-sex attraction. They look at, they have higher rates of suicide, 8 times the risk of suicide. They have earlier onsets of cancers, that usually by age 41, they're having cancers. So, you know, they were looking at all the things, and the point that I remember that he said was, you know, if you have a child driving a car and you see they're heading off a cliff, you're going to say, don't go that way, you're going to stop them, right? He says, but what do we do in society when you see somebody saying, you know, these teens are, well, I don't know, I think I might be attracted to same sex, and, you know, society says, well, you have to just be supportive of what they want. He says, no, tell them they're heading off the cliff. You know, he says we have to let them know these are the things that are happening. He gave a couple examples of two young men that he had been dealing with, and it was interesting how he presented that. So all these talks that they gave are available through the national website, so if anybody has any areas that they think they might want to hear more about that, you can always go on to the National CMA website and you can order any of those talks. I love to listen in the car. As far as the mind healing, there is talk about the pornography, which is becoming more rampant, especially with internet accessibility. There is a DVD that taught, it's like a parent workshop. It's called Unfiltered. Dr. So I have little pads there if anybody wanted to write down like any of the websites or anything, so you could do that. But it talks about how to restore, the thought process of what they're doing, and also with that integrity restored, you can find a therapist trained into that, so who can help if somebody's into pornography. The marital healing. Dr. Fitzgibbons did a thing on divorce prevention, and he said that people bring into the marriage different things that they have, that they were raised, born, whatever. So maybe they have anxiety, maybe they have other issues or phobias or whatever, and sometimes they have trouble with conflict. So if you know somebody's having an issue, in my field, I'm a pediatrician, so sometimes I'll say, how's the family, and if there's problems, I'll pray for them, but I might make suggestion on a book or something. So, these are things that we can pass on besides just our medical knowledge. But he has a website too called maritalhealing.com, and that's got a lot of information on there. The spiritual wounds and healing. This was very interesting too. There was a lot of it's funny because then you have the first one was a lot of the doctors, the second part was, the psychologists, and then the third day was more the priests and other theologians or whatever, but we had a bunch of interesting speakers there too. So we, as physicians, as healers, also have to feed ourselves, nourish ourselves spiritually, so that we can see and understand what's God's teaching, and then we can present it to others. One of my favorite saints, Saint Jose Maria Escriva from Opus Dei, his thing is that your Catholic faith is not a hat that you can take off when you go to work. That's something that you take with you no matter what area of your life you're with. This is your whole being, and that we need to nourish ourselves with the sacrament, nourish ourselves with spiritual reading, and then we can present that to others. There's that whole interplay that we can't forget. The best part of the spiritual thing that I liked was this. Dr. Robert Spitzer, I don't know if anybody, Dr. Father, he might be a doctor, I can't remember. But he has a book. What's the name of the book again? 4 levels, I know it's happiness, right? Finding happiness or something. But he talked about the 4 levels of happiness. And he said your first level is your immediate gratification, right? But we all know you can eat a candy bar and it's good. You can have a glass of beer on a hot summer day and this is great. It's immediate, but it's very short-lived, right? Your second level is your achievement. So it's like, I did that marathon, you just that. So those are a little bit longer lasting happiness, you feel good about it, but it's not that long of a lasting thing, right? It's still more filling your own ego. If you get beyond yourself, right, that 3rd level of happiness, so that's a little more long-term. That's where you're actually contributing to the good of society. He said, all of you in healthcare professions, no matter what you're doing, you're already in the 3rd level. So you're already got a good start on it. You're in a good place. The 4th level, he said, is really the ultimate good. You're really sacrificing yourself for others. the one thing that he said was, if you want a get out of hell card for free, he says you just gotta go up to the 3rd and the 4th level. That was pretty cute. Our keynote speaker, another phenomenal presentation. Gianna Jessen, some of you probably know who she is. She is a 38-year-old, born in April 1977, a product of a failed abortion. So her mom, 17 years old, at 30 weeks gestation decided she's going to have an abortion. 30 weeks gestation. Couldn't get it where she was, went to another state to get an abortion, and went into Planned Parenthood for a saline injection. The doctor was not there. The nurse administered the injection anyway, and the baby came out breathing. And the nurse didn't know what to do. She knows that the doctor was there, the doctor would finish the baby off, that's what he's supposed to do. Thanks be to God, the doctor was not there. The nurse laid a towel on her and called an ambulance, and they came and took her, and she survived. She does have cerebral palsy, but now she is an anti-abortion activist and a disability rights activist, because, you know, our culture now says if your baby's not going to be totally normal, then just get rid of it. So it's something that she's just making an awareness that her life is worth living, and you know, there's alternatives to abortion. What I was most impressed with her, and it's the only reason I'm up here today, speaking as much as I am, is that she talks about how God uses the weak to do His work, and how she's just so weak, not really that educated, but she just feels God's calling her to do this. And she would talk, and there were times where she was saying things that just seemed so profound, and I was like, oh my gosh, like I could see the Holy Spirit moving through her, and I'm thinking, well, I guess maybe I could do it then, if I didn't trust God to, you know, send the Holy Spirit to help me through. So, because of that, I really have been trying to do more, become more involved. I mean, there's a lot on my plate with my family and everything, so I said we have to really try harder to make this more well known. So, Steve, I'm going to ask Steve to stand up. Please. Yes, you. Yes, you. Steve here is our man who put up the website for us. And I didn't have to mortgage my house. So, you know, with a little bit of help, I'm thinking this is how we're going to try to get the word out there, and then we can become a bigger organization, stronger organization, and then we can do more teaching out there. The next conference is going to be Washington, D.C. It's in October this year. The title is, the theme is Virtuous Medicine. They might even have some preliminary things on the national website where they tell you who the keynote speaker is, or some of the talks, or what they're going to be doing. But I would suggest that if you're thinking of going, that you sign up early, because a month before, I think they were sold out this last October. So if you're thinking of doing it, I would say sign up early. Okay,